today, we're going to do a return demonstration about Abdomen Assessment. Good day, sir. I'm Christine, your slit nurse for today. May I know your name, please? Your date of birth? Okay, thank you. I'm going to assess on your abdomen area. So this is to check for any abnormalities, and all the significant findings will be cascaded to your doctor for the next treatment plan. So, Mr. Tony, I might ask you to undress for me and change to a hospital gown for the assessment. And do you need any help in changing your clothes? Next, I'm going to assess the patient to a supine position, and I'm going to expose the abdomen area. The first thing that I'm going to check is I'm going to inspect the abdomen area. I'm going to check the color, the venous pattern, the integrity, the contour, symmetry, and the umbilicus. So for the findings, the color of the patient's abdomen is normally paler, and for the venous pattern, it is fine veins are observable. The integrity is no rashes or lesions, and for the abdomen, the contour is rounded and symmetrical. So for the surface, no movement or slight peristalsis visualized over the aorta, and the umbilicus is light brown and sandy. Next is the auscultation, and I'm going to use the pattern starting with the right lower quadrant, the right upper quadrant, the left upper quadrant, and the left lower quadrant. And I'm going to listen about a minute to each quadrant in order to conclude that vowel sounds are absent, and I'm going to listen 3 to 5 minutes. For the findings, the vowel sounds is high pitch and irregular gargles, ranges to 20 times per minute, present equally in all quadrants. For the vascular sound, we need to auscultate the following. First is the hepatic friction rub, the splenic friction rub, the aorta, the renal artery, the venous hump, the iliac artery, and the femoral artery. And I'm going to use the bell of the stethoscope. For the findings, there are no grooves, no venous humps, and no friction rub. Next is percussion. I'm going to percuss the abdomen of the patient, and I'm going to use the same pattern. And to proceed, I'm going to use a clockwise pattern for the percussion. for the findings, there is a presence of tympani in the hollow organs such as stomach, intestine, bladder, the aorta, and the gallbladder. While on the liver, the spleen, the pancreas, kidney, and uterus, there are dull sounds on these areas. Next is the palpation. The first is the light palpation. I'm going to palpate the abdomen with a dip of 1 centimeter, and I'm going to use the same pattern. I'm going to start at the right lower quadrant to the right upper quadrant, and to the left upper quadrant to the left lower quadrant. And I'm going to check for its tenderness, the consistency, and the masses. Next is the deep palpation. I'm going to palpate the abdomen of the patient 5 to 8 centimeter, and I'm going to follow the same pattern also. Next is the liver border. I'm going to check its tenderness and the consistency, and I'm going to stand at the client's right side, and I'm going to place my left hand on the client's back, and I'm going to place my right hand parallel to the right costal margin, and I'm going to ask the client to breathe deeply, and I'm going to press upward with my right finger with each inhalation. For the findings, it is non-tender and it is smooth, firm, sharp edge, and no masses. Next is the splenic border. I'm going to check its size and the tenderness, and I'm going to stand at the right side of the patient, and I'm going to reach across the client to place my left hand under the client's posterior lower ribs and push it up. Then I'm going to place my right hand below the rib margin, and I'm going to ask the client to breathe deeply, and I'm going to press together to palpate sleep on inhalation. Sir, could you please breathe deep? And for the findings, it is not normally palpable and non-tender. Next is the kidney. I'm going to check its tenderness and the masses, and I'm going to stand at the right side of the patient. I'm going to place my hands behind the lower edge of the rib cage and above the iliac crest, and I'm going to place my other hand over corresponding the anterior surface, and I'm going to instruct the client to deep briefly, and I'm going to lift up my lower hand while I push my upper hand as the client exhales, and I'm going to repeat it on the other side. Sir, could you please speak briefly? So for the findings, it is not normally palpable, non-tender, no masses, no increase in abdominal girth, no fluid wave transmitted, and level of dullness does not change. And lastly, I'm going to assess the appendix area. I'm going to check the rebound tenderness. I'm going to palpate or press down the patient's right lower abdomen and then left my hands. Then I'm going to, for the rebound tenderness, it is when there is no pain and pressure is applied, but painful once pressure is removed. Do you feel any pain, sir, after I lift my hands? So for the findings, there is no pain elicited upon palpation. So sir, I have gathered all the information needed. Rest assured that all the information conclusions will be kept confidential and will be cascaded to your doctor for the next treatment plan. So, thank you, sir, and have a good day.